Thank you for joining us. On Veterans Day, we recognize the selflessness and sacrifices of the millions of service members who have devoted themselves to our country. From World War I and II to the Vietnam and Korean Wars, to the Gulf War and the global war on terror, members of our armed forces have stepped up time and time again. They put themselves in harm's way to advance the causes of our country. So when we ask these brave individuals and their families to take risks for our nation, we need to have their backs. In the course of war, our service members are exposed to threats of all kinds. During the Vietnam War, one of the most enduring threats was exposure to the toxic chemical Agent Orange, which has left hundreds of thousands of Vietnam-era veterans with countless medical ailments. New York State is home to more than 240,000 Vietnam-era veterans, thousands of whom were exposed to Agent Orange and have since been diagnosed with bladder cancer, hyperthyroidism, and Parkinsonism. The National Academy of Medicine, whose reports have been the scientific standard of association since the Agent Orange Act of 1991, established the link between these conditions and Agent Orange exposure in 2016. But the VA has refused to recognize those links and has continued to deny veterans with these conditions the care they need for years, knowing full well many of these veterans don't have years to wait. That is why, as Congress prepares to finalize the National Defense Authorization Act, I joined my colleagues on both sides of the aisle to support an amendment that would create a presumption of service connection for these illnesses and include them on the VA's list of medical conditions associated with exposure to Agent Orange. It passed in the Senate with 94 votes. I also signed a letter to conferees to ask them to retain this amendment in the final bill. It's past time for Congress to acknowledge the overwhelming science and political will behind this amendment and to address the suffering of these veterans. Establishing this presumption of service connection for bladder cancer, hyperthyroidism, and Parkinsonism will help the estimated 34,000 veterans nationwide who are living with and dying from these conditions. Treating these illnesses is part of the cost of war, and the VA must cover them. It's also time for Congress to acknowledge that these diseases resulting from exposure to toxic chemicals are not a relic of history. Approximately 3.5 million service members who deployed to bases in more than 34 countries, including Iraq and Afghanistan, could have been exposed to the toxic smoke and fumes from burn pits. Many of them are sick and dying from these lung diseases, cancers, and respiratory illnesses. But when they ask the VA for care, they get the same response these Vietnam veterans do. The science isn't there to prove these illnesses are service-related. That's unacceptable. That's why I introduced the presumptive benefits for war fighters exposed to burn pits and other toxins act. That bill would establish the same type of presumptive service connection for veterans exposed to burn pits and other toxins that Amendment 1972 does for Vietnam veterans. We're still fighting for the VA to cover Vietnam veterans' service connections. 45 years after the war ended, and that is shameful. We cannot let that sorry history repeat itself. No veteran should have to fight the VA for care that's linked to their service while they are fighting for their life. For the VA to drag its feet before providing necessary care is not only a dereliction of duty, it's outrageous. Our veterans must have access to the benefits that they've earned and the health care that they need for the illnesses they developed as a result of serving our country. I will keep fighting until they get it. It is the very least we can do for those who have done so much for us. Now I'm happy to take your questions.